Our first question is, tell us a little about yourself.
Okay, so my name is Sheldon Jolie. Patients refer to me as Dr. Jolie. I am 31 years old, male from St. Lucia. Currently, I am married. What I like to do for fun in my spare time, I can be found for hours on end going over vehicles. I'm very interested in vehicles and engines in particular as to how they run. And what it is that my goal is in life is that I would like to become a surgeon one day, in specific a urologist.
My name is Dr. Ijoma Amala. I'm a board certified plastic and reconstructive surgeon, a fellow of the Nigerian Association of Plastic, Reconstructive and Aesthetic Surgeons, and I'm a consultant at the University of Port Harcourt Teaching Hospital. I am also the head of my unit, Department of Plastic and Reconstructive Surgery, UPTH, for the past nearly 4 years now. And I also head the Regional Burn Center at the University of Port Harcourt Teaching Hospital.
Why do you want to become a surgeon?
Okay. I want to become a surgeon for two main reasons. One, it's because I would like to give back to the community at large, and specifically for what it is I went through in terms of a surgeon having saved my life. That's one. And two, I love the idea of seeing patients come into the hospital who are sick or acutely ill, getting the surgical expertise that is required, and leaving the hospital in a short space of time. That right there is why I want to go into surgery. I love seeing my patients actually get better overnight, so to speak.
Why did you pick the field of surgery?
I picked surgery because I felt because surgery best expresses the kind of person I am. I am someone given to activity. I like to work with my hands. So while in caring for the patient, one can be able to intervene and help the patient to be better, be it surgically or through other interventions. Surgery is an action-packed discipline, so it you use your brains as well as you use your hands to be able to effect the management that is best for the particular patient you're dealing with.
What would you say is the most challenging part of working in the surgical department?
Okay. So the most challenging part of working in the surgical department, I would say, is it is twofold. It has to do with sometimes dealing with difficult consultants, um, and it may sound funny, but it is true. You can expect that as you embark on your surgical career, and for those of you guys who want to become surgeons, that is a thing. So learning people's skills early on is crucial in your progress as a surgeon. The second thing, which seems to be shared between many Caribbean islands and even the UK at large, is just getting patients to the operating theater. I cannot stress how difficult it is to just get a patient there, simply because the number one roadblock in preventing a patient from getting an elective surgery, elective meaning that it is not urgent but necessary, is the fact that the hospital is almost always full on beds. If there's no beds for patients to get elective surgery, no surgery can be done. These would have to be the most challenging aspects, I dare say, of working in the surgical department.
What would you say is the most challenging part of surgery?
The most challenging part of surgery is the time that you invest in building yourself and your capabilities, and also in helping your patients to get to their optimal health. As a resident, when I was training, I had to juggle a lot of things. I was a mother, a wife, and so I had to combine all these responsibilities with my role as a surgical resident, as well as also dedicate time to my academics to be able to excel and finish my residency. Well, then as a consultant, I feel that the time demands are less because you have younger colleagues who attend to emergencies at first and respond to calls, and then you come in, one has to come in to, carry out assessments and also do the surgery. As a consultant in the hospital where I work, I put in 3 days. The first, we have clinic days, we have days for the consultant ward round, and I have a dedicated day for my theaters. And so with that, one can be able to have some better work-life balance for herself.
What is the most fulfilling thing about being in the surgical department?
Um, as previously stated, one of my joys, or I should say the most fulfilling thing for me working in the surgical department, is seeing my patients get better. In addition, the doctor-patient relationship. As you would come to imagine, that is the fundamental building block of becoming a doctor. In most cases, except for pathology, I believe you have to maintain some degree of DPR, doctor-patient relationship. Along with seeing my patients get better, the fact that my patients feel comfortable enough to come to me at any point in time, whether it be in the hospital or the outpatient clinic, sometimes even on my cell phone, and able to discuss with me the issues that they may face, and my ability to help them is one of the most fulfilling things. Just seeing that satisfaction on that patient's face, whether it be surgical or non-surgical, but seeing them get better and exiting the building in one piece is the most fulfilling thing I dare say about when working in the surgical department for me. Surgery is one of those specialties whereby patients can get well almost instantaneously overnight. For example, a patient comes with a ruptured appendix, gonna die shortly from sepsis. You do the surgery, by the next morning, totally different person. Another example, a patient has multiple stab wounds and multiple gunshot wounds. Blood pressure is 40 on 20, pulse is 150s, pupils are white out, basically bleeding to death internally. You do what it is you need to do surgically, in addition to the allied health. By the next day, the patient looks like they never underwent what was happening to them last night, i.e. gunshots and stab wounds.
What is the most fulfilling thing about being a surgeon?
The most fulfilling thing about being a surgeon is the impact one is able to have on your patients. In the environment where I work a lot with burns patients, patients who have crush injuries to different parts of their upper limbs or lower limbs, and road traffic accidents, and also deal with patients who have congenital anomalies like cleft lip and palate. The most rewarding thing is to be able to help these people come out of the situation where they are, help them to heal, even if it means losing a part of their body, but it helps. My work as a reconstructive surgeon helps to reconstruct that body part so that the patient can have a more meaningful life, so that their quality of life improves. For the patients with congenital anomalies, the smiles on the patient's faces or the parents' faces is enough reward for all the time and dedication one puts into this patient's care and management.
Can you speak on your work-life balance?
Okay. This one is going to upset a lot of people. um, However, there is no work-life balance. My life now revolves 80 to 85% work and 15 to 20% life. What I mean by that is we work a 40-hour week, a standard 40-hour week, i.e. we work from 8 o'clock in the morning to 4 o'clock in the night, Monday through to Friday. In addition, at least twice a week we do what is called on calls. On calls entail a 16-hour shift. It starts from 4 o'clock in the afternoon till 8 the following day. A lot of people get it misconstrued that at least in our part of the world, that once you get to 8 o'clock the following day that you are allowed to go home. In some countries that holds, but in my country, even when you get to 8 o'clock the following day, you are still mandated to work 8 to 4 that same day. So my work-life balance is pretty terrible. Working in the surgical department is very, very exhausting. I can say one of the perks of working in the surgical department is that you are compensated fairly. I will not say it's extravagant, but you are fairly compensated. So it sort of evens out the excess working. But that is it. A lot of times you find that you don't have much time to do anything else outside of the hospital, except when it applies to your vacation. During the working week, and again, calls are not limited to the working week. You can be on call on Saturdays or Sundays. It takes away a lot from you as an individual. So if it is that you are planning on embarking on such a journey, you need to bear in mind that most places, the surgical department does not have a good work-life balance.
Can you speak on your work-life balance?
I had spoken about it earlier. My work-life balance now as a consultant is better, but I am also saddled with administrative duties, and so I will say that it's a healthy work-life balance because I am able to integrate all aspects of my life and coordinate them well. So this is a win-win situation. My work does not suffer while my personal life does not suffer as well.
What advice would you give to medical students considering a surgical residency?
First of all, they have to know themselves. What drives you? Are you someone that is driven to action? Are you someone that likes to work with your hands? Do you like that adrenaline rush of having to think and do things on the go? Then I'll say yes, surgery is for you. But you have to be mentally prepared. It can be tasking, and there is no favoritism, or you're not given any preference whether you're a woman or a man. You have to get the things done. Sometimes you have to put in more hours than you bargain for. Sometimes you have to work even beyond your call hours just to make sure the patient is saved. So you have to come with that mental preparedness to know that it is more of giving of yourself, of your time, of your skills to help the patient to survive and to be better. So if you come with that mental preparedness, you'll be able to withstand the challenges.
You need to understand that once you decide to embark on that journey, it is one of the most difficult specialties to do once you've attained Doctor of Medicine, MBBS, and you decide to want to specialize. It is the most difficult one. Any surgical specialty is more difficult than their counterparts, i.e. pediatrics, etc. You need to bear in mind that you need to have some sort of support when undertaking such a journey. Me, for example, I had the support, and I continuously have the support of my wife, which is why I've gotten as far as I've gotten. Some people may not be so lucky as to have a significant other. Some people may have a parent, whether it be aunt, uncle, etc., mother, father, and the likes. That is the most important thing, and one of the fundamental building blocks to your support that will enable you to, through times of stress, overcome that to achieve higher and to persevere. If it is that you don't have sound support system, the very likelihood of you completing such a journey is next to none. I am sure all of you that are in medical school right now listening to this is capable of becoming a doctor. You guys would not be here if you did not already have the intellect. But what you need to understand is, again, you need to have a sort of support system when you decide to go and embark on such a journey. That is my advice to anybody who wants to become a surgeon. Make sure you have a strong support system, and you should be alright. Thank you.